Breathing was almost impossible. I could, but it took lots of breaths to get a little breath of air.
Hello, my name is Dr. Mayank Agrawal. They call me Dr. A, and I'm one of the intervention cardiologists at KRMC. Basically, I'm the plumber of the heart, and I specialize in procedures called structural heart.
Hi, my name is Dr. Rawa Sarji. I'm an interventional echocardiologist. I work in basically obtaining echocardiographic images of the heart and the valves, and I do the procedure before patients have any sort of structural procedure and during the actual procedure or surgery. The mitral valve itself is composed of two leaflets. It allows blood to flow from the left atrium, which is the upper chamber of the left heart, into the bottom chamber of the left heart, which is the left ventricle, and the left ventricle pumps blood to the rest of the body. In mitral regurgitation, the blood leaks backwards instead of forward into the ventricle, leaks backwards into the atrium and back into the lungs, creating quite a bit of symptoms, which involve, again, shortness of breath with activity, reduced activity tolerance, and heart failure.
So my name is Paula French, and I am the nurse practitioner and the coordinator for the structural heart program. And so my job is to take patients who may be candidates for our services and see them through from start to finish. So the valve program that we have is for patients who are too ill or too fragile or are not able to have open heart surgery, and therefore they have no other options. And so we use minimally invasive techniques to access the heart and to repair valves, and in Bill's case, to repair his mitral valve.
This procedure is called percutaneous mitral valve repair, where we take this small catheter through the femoral vein, and we go on the right side of the heart, and through the membrane we go towards the left side where the mitral valve is situated. And through this small little catheter, we take what we call is a small MitraClip. It is about a 1.5 centimeter device, which just looks like a housefly, and we open it and cross the valve, and we get the leaking mitral valve leaflets between what we call is a clip arm and the grippers, and we decrease the leakiness from the valve. Once we are done, we take the entire system out, leaving the small little 1.5 centimeter clip in the patient's body.
Yeah, I felt like I was their only patient. They looked after me and took care of me, and I felt almost like being with family. You know, they treated me as if I was part of them, and took care of every possible need that I would have ever had. Probably some advantages living where we were, because we didn't have to travel to get the surgery done. Wednesday morning I had the surgery, and I got to come home Friday afternoon. Oh, it's kind of like a changed life. I could breathe. That was the first thing I noticed when I woke up, was I could breathe, you know. And before that time, I just about had to count every breath.
So the goal when we repair a heart valve is for a patient to feel better and for symptom management, for them to have less shortness of breath, better quality of life, and that's our overall goal when we repair valves. And that was something that we were able to achieve with Bill, which is very exciting.
No, it just was a miracle. Everyone says that because he was so down, so fragile before that it just was a miracle, because he walked and he could breathe. I don't think I had much to do. He's always been self-starter, so.
Yeah, but I always had somebody behind pushing. None of this giggly stuff. Your nose is cold.
Is it? Our noses get in the way sometimes.
Yeah. We've been battling this for years. It's her nose, it isn't mine.